The most common question that any patient has once being advised cataract surgery is that will I have to wear glasses after my cataract surgery is done? I hope all my number goes away after cataract surgery. I've heard about so many lenses, so many good things, so many bad things. Which is the lens which is best suited for my eye and so on. So let's try and understand some of the basics of the different types of intraocular lens options that one has today in today's medical science. So grossly, there are three basic kinds of lenses. One which we call as monofocal. So monofocal means a single focus. So whenever we plan a monofocal lens, we try in such a way that we try and correct as much as possible of the distance number as much as can be done. And for intermediate to near, most individuals will have to wear glasses ranging from 2, 2.5, 3 or progressive glasses or bifocal glasses. It's not as if the number for distance becomes perfectly zero for everyone. If we measure in every eye, there is always some residual number left behind, but majority individuals after both eye surgeries done tell us that most of their distance visual acuities are corrected without the need for or dependence for glasses at all activities. The second kind of lens is a trifocal or a multifocal lens, which means it takes focusing from three different points. One is from the distance objects, one is from the intermediate objects, and one is from the near objects. So the aim of a trifocal lens is to try and reduce the dependence on glasses across the range of distances starting from distance up to reading. And therefore, after both eye surgeries are done, most patients come back and tell us that they now don't need to depend on glasses for their routine activities, which would mean from distance as well as reading newspapers and phones. Once again, if we measure in every eye, there will always be some residual number left behind for distance, intermediate and near. Having said that, still most patients feel that they can manage their activities without glasses. Some individuals, like even if they have a slightest residual number, do feel that for some specific activities that I do, if I wear that small little number, I feel more comfortable. So the aim of the trifocal lens is to try and reduce the dependence on glasses for most of our day-to-day or routine activities. The little gives and takes that come with trifocal lenses are that with a trifocal lens, if I focus at any distance point force of light, which means if I look at a bulb or a headlight or a street light which is far away from me and I focus on that light, I may see some rings or 2-3 circles around that light, which are typically called as halos. As those lights come closer to us, those halos tend to reduce or disappear. And most individuals after both eyes are done, the brain gets adapted to seeing them. So 3 to 6 months down the line, most patients don't even notice that they see certain rings or halos around light. But if you actually look at a focused light and try to find them, you'll always find them after trifocal lenses. With the newer generation trifocal lenses, these are not disturbing enough to bother in regular city night driving, where there are dividers, street lights, so on and so forth. But if someone is a regular highway night driver or has to, for work or other reasons have to drive significantly on country roads where there are no dividers, no street lights, so on and so forth, those patients need to be cautious about selecting a trifocal IOL because night driving can be a little challenging in certain specific situations. Further, with trifocal lenses, when we do our near activities or our reading tasks, good lighting conditions are usually advised, which means that in very dim light conditions, say like in a restaurant with very dimly lit lights, you may find that if I switch on my mobile light and look at the menu card, I am able to read it better than without the lights being on. So these are the 1 or 2 small gives and takes of trifocal lenses. The third kind of lens is something what we call as an extended depth of focus lens, which means that like a monofocal lens, it tries to aim to give a good distance vision with minimum need for glasses, and it stretches the focus from distance to somewhat intermediate and little bit of functional near vision. without the disadvantages of having light related halos or other issues. The major or the only sort of negative of an extended depth of focus lens is that it will not be that you will not need glasses for all activities. So particularly for reading, and that means mainly fine print reading, you will need glasses after an extended depth of focus lens, although that number will be significantly less compared to a monofocal lens. Like in our glasses, we have plus numbers, minus numbers and cylindrical or axis number glasses. Similarly, when we do the pre-operative checkup before surgery, we also do all of these measurements for the eye so that we can decide what power lens we want to place inside the eye. So when we do these measurements, and if we find that the cylindrical power, which means the shape of the cornea, is more oblique in one axis than the other, then we suggest a modification in any of these lenses known as a toric lens. Toric means cylindrical power. So the toric lens can be in a toric monofocal lens, toric trifocal lens, or a toric extended depth of focus lens as well. So when the cylindrical power exceeds a certain minimum number, we suggest that whatever the type of lens you choose, you must undergo a toric version of that lens in your eye, and it could be either in both eyes or only one eye, as and how it may be required. So the commonest question after all of this is that, doctor, we trust you and we choose the best that you think is best for our eyes. So what is best for my eye? For this, we do a detailed, extensive pre-operative examination and evaluation right from the front surface of the eye to the back surface of the eye, including the retinal evaluation and retinal scans. So not all eyes are unfortunately suitable for all IOLs. For example, if a patient is very desirous that I want to get rid of all my glasses, including my reading glasses, and I am very keen on a trifocal lens. But if during the pre-operative evaluation we find that there are certain ocular parameters which would not give a good outcome after a trifocal lens, we would suggest that although you may want to be opting for this lens, it may not be in your best interest to consider this for the long-term future of the eye. So the actual type of lens which would be best suited to your particular eye, we come to know together after a detailed pre-operative evaluation and thorough discussion with the patients. In spite having done everything perfectly, all proper investigations, perfect surgery, perfect outcome, there will always be some patients who might be left behind with little more or little less number than what we had targeted or what we had anticipated. And that unfortunately is a limitation of medical science, because our body, our healing doesn't always behave like mathematics 1 + 1 = 2. The only thing that we can try our best is that in today's medical science, whatever the best that we can do in terms of pre-operative evaluation, intraoperative surgical precautions and post-operative care, we try and deliver that best to the patient. And like for everything else, we do need some support from upstairs as well. So now we have some of these wonderful lens options, which some of them were not there just few years back. So in today's time, we are able to pick and choose depending on a person's lifestyle, his working needs, his requirements post-operatively, his profession, so that we can pick and choose which kind of lens or which kind of vision will be best suited for his post-operative number of years to come, which will help to improve his quality of life across all different sectors of his activities.